1 in 9 Australian children has asthma. It's one of the most common reasons children visit their doctor or go to hospital. It is important to know that children are not simply small adults. Information that applies to adults does not always apply to children. This section gives you some important information, especially related to children with asthma. It is important, though, to talk to your doctor if you are unsure of anything about your child's asthma. How do we tell if our child has asthma? Children with asthma can have many different symptoms. They may have trouble breathing. They may wheeze or have a persistent dry cough. Your child may feel breathless. They may have trouble describing this sensation and may even describe discomfort in their chest or tummy. There is no test that proves a child has asthma. However, children with asthma will have repeated bouts of wheeze and difficulty breathing. Your doctor will ask you questions about your child's breathing to make sure they do not have any other condition which could also make them wheeze. They may even try asthma medication to see if the child's symptoms get better. Children who are 6 years and older may be able to do breathing tests called lung function testing. Wheeze is a high-pitched musical sound, typically heard when a child breathes out. It is caused by narrowing of the small air pipes of the lungs. Because children are smaller than adults, their air pipes are smaller and they are more likely to wheeze. Children may make a purring, rattly sound when they breathe. This is not a wheeze. Make sure you tell your doctor about any sounds your child makes when breathing. Children with asthma often have a dry cough. Cough is a common symptom in children. Children who cough and who do not wheeze are unlikely to have asthma. Your doctor can talk to you further about this. It is common for young children to wheeze when they have a virus or cold. Many children who wheeze when they are young stop wheezing by the time they start school. Some children who wheeze only when they have a cold may not have asthma. Some asthma medications that are used in adults may not work in young children with wheeze. You and your doctor may decide to trial medication. It is important you understand what medication your child is taking and how it is to be taken. If the medication does not appear to be working, talk with your doctor. How do you tell if your child is having an asthma attack? They may appear to breathe faster or harder than normal. You may notice the skin above your child's collarbones or over their lower ribs sucking in. You might also notice their stomach sticking out more than usual as they breathe in deeply. They may also say their chest feels tight or sore. You may hear wheezing. This is a high-pitched musical sound when they breathe out. It can sometimes only be heard by the doctor. They may also have a persistent, irritating cough that is usually dry. You may notice this first at night or early morning, and it's often present after they have been playing sport or running around. You may just think that something doesn't seem right with their breathing. Every child will show different signs, so it is important you know your child well and don't be afraid to see your doctor if you think you need to. It is important that your child has an asthma management plan. This plan should be specifically for your child and written by your doctor. It tells us how to manage your child when they are well and what to do when they become unwell. It takes into account the severity of your child's asthma. Keep this plan up to date and make sure it is in a place you can find it easily, maybe on the fridge. Share this plan with others who may need to manage your child when they are unwell. What do I do if my child is having an asthma attack? If you have an asthma management plan, then you should follow that. If you don't have a plan, or if you are unsure what to do, then follow the asthma first aid plan. This is the same for adults and children. However, very young children may need to use a face mask with their spacer. An asthma attack can be frightening for both you and your child. Step 1. It is important to remain calm and sit your child upright. Step 2. Give reliever medication. Use your child's spacer. How to use a spacer is explained in another section. All reliever medications are blue. Shake the blue puffer and take the cap off. Puff 1 puff of medication into the spacer. Watch your child take 4 effective breaths. Repeat this step 4 times until your child has taken a total of 4 puffs of medication.
Very good.
Step 3. Wait for 4 minutes. At the end of 4 minutes, look at your child's breathing. Do they look and feel better? Is there any improvement, or are they still breathing faster or harder than normal? If they are not better, give another 4 puffs of reliever medication as before.
4 breaths slowly. 1, 2, 3, 4.
Step 4. If your child is not improving, you should seek further help. It is difficult to give general advice. However, acute asthma that is not responding to reliever medication is a medical emergency. Dial 000 and talk with the operator.
Hello, ambulance. Yes, my 2-year-old son's having an asthma attack.
Continue to give 4 puffs of reliever medication every 4 minutes until emergency assistance has arrived.
4 breaths slowly. Ready? 1.
Step 1. Remain calm. Sit the child upright and locate your child's asthma management plan. Step 2. Give reliever medication. Give 4 puffs via a spacer. Watch your child take 4 effective breaths after each puff of reliever medication. Step 3. Wait for 4 minutes and check to see if your child has responded. If no improvement, give another 4 puffs. Step 4. If your child is not improving, call an ambulance. While waiting for help, continue to give 4 puffs of reliever medication every 4 minutes. Children with asthma have recurrent bouts of wheeze and difficulty breathing. Wheeze is a high-pitched musical sound, typically heard when a child breathes out. If your child is having an asthma attack, follow their asthma management plan, or the asthma first aid plan. Managing asthma is different in children and adults. Some medications do not work well in young children. The goal is for you and your child to lead an active and healthy life.